A medical doctor, N88BN, joins me now for discussions on this development. Good to have you join us, Dr. N88BN. Now, the plan here, according to the Minister of Health, Abosage Hanire, is to have at least one sample collection center in every local government in the country. How effective will this be in terms of curbing the spread of the virus?
Well, thank you so much. Trying to expand testing is desirable, is most apt, is necessary, and may be the right step. Now, but if you look at it from the time that WHO declared this as a public health emergency of international concern in January 30th, Nigeria, we've only tested just barely 340,000 out of the 200 million population. If we compare that to South Africa, who has tested their population of 50 million, and they've tested more than 1 million people, we know that we're far behind. If you now look at Nigeria's response in terms of ability to respond to international health emergencies, we score very low. In terms of prevention of biohazard or public health challenge, we score very low. We also, in detection, which is testing now, we're trying to struggle. But even in response, we are very low. So in a way, if you do that, it's not just about collecting samples. It's also about ensuring the capacity of the laboratories, ensuring that human resources are added to it, ensuring that appropriate response is pushed along the side of testing. You cannot just do, containing COVID is not just testing alone. Testing is an integral part of it. But the response that comes after testing is also critical.
All right.
Now,
if I may come in there, Dr. N88BN, because over and over again, we've heard the Director General of the NCDC say that testing isn't the problem, that it's getting the samples to the laboratory that is the problem. But you say that that is not the challenge. So what more should we be doing at this moment?
Now, again, listen, it is nice for us to pick samples from each of the local governments. You understand? Now, when you have to try and take it to the laboratory, in the laboratory you need human resources, you need the requisite. The laboratory is not just another laboratory, it's not a side laboratory. It's a PCR lab that requires thorough testing. How many laboratory scientists do you use that can do that? So don't let us deceive ourselves. Even the one we're doing now, how long does it take for us to get the result back? Some have to wait as much as 1 week to get the result back. Now, you can take as many samples as possible. That is nice. Until we declare result appropriately, that is when we say that the testing is complete. The testing is not just about taking samples. So what I'm saying in essence is that we need to strengthen capacity in the laboratory in terms of human resources and other necessary reagents, because logistics of picking samples and taking to the laboratory should not be a difficult thing. But the key thing is actually to get the test done and bring the result out as soon as possible. So that is where we need to work on now. Because even at the testing level, you have to kiss those people that are going to test those things. You have to train those people that will test it. Are they telling us that they've trained that number of people that will be able to test all this, take the samples, as it were? So, but it's heartwarming, it's impressive. We're happy that they're thinking in that direction. But they must also know that, testing is not just, containing COVID is not just about testing. You have to move to ability to respond appropriately after the results are out.
Medical Doctor N88BN, many thanks for talking to us.